1. Pneumonic plague, the deadly legacy of the Black Death in modern Arizona. 2. Tragic pneumonic plague death in Arizona. What you need to know. 1. Pneumonic plague, the deadly legacy of the Black Death in modern Arizona. Imagine a disease that conjures images of medieval times and the devastating Black Death, yet still lurks in the shadows of modern society. A recent case in northern Arizona serves as a stark reminder that the flea-borne plague, responsible for the infamous Black Death, is far from eradicated. This incident highlights the persistent presence of the disease in certain regions of the world, including parts of the United States. Local health officials in Coconino County, which encompasses Flagstaff, confirmed a fatal case of pneumonic plague, a severe lung infection caused by Yersinia pestis, the bacterium at the root of the illness. In the United States, human infections and deaths from plague are relatively uncommon. The Centers for Disease Control and Prevention reports an average of 7 cases per year. The most recent death prior to the Arizona case occurred in 2021. Why? Pestis made its way to U.S. port cities around the turn of the 20th century and has since become endemic among rodent populations in several western states, including New Mexico, Arizona, Colorado, California, Oregon, and Nevada. David Wagner, executive director of the Pathogen and Microbiome Institute at Northern Arizona University, who has studied plague for over 2 decades, emphasizes that while the occurrence of plague is alarming, it is exceedingly rare. He notes that the risk of encountering plague is significantly lower than the risk of being involved in a car accident, underscoring the importance of prioritizing everyday safety measures over concerns about plague exposure in the western U.S. To support high-quality science journalism, consider subscribing to Scientific American. Your subscription helps ensure the continuation of impactful storytelling about the discoveries and ideas shaping our world. Scientific American interviewed Wagner about the signs and symptoms of plague and its enduring presence over time. Here's an edited transcript of their conversation. How does plague spread? Plague is caused by the bacterium Y. pestis and primarily affects rodents and their fleas. An infected rodent is bitten by a flea, which then carries Y. pestis. When this flea bites another rodent, it can transmit the bacterium. This cycle has persisted for thousands of years, allowing plague to remain in various environments worldwide. What are the differences between bubonic and pneumonic plague? All forms of plague, Black Death, bubonic, and pneumonic, are caused by the same bacterium but manifest differently in the human body. The Arizona case involved pneumonic plague, which is relatively rare in the U.S. Most human cases are contracted from flea bites, although pneumonic plague can spread person to person through coughing or direct contact. Bubonic plague typically progresses to pneumonic plague if left untreated, allowing it to enter the lungs via the bloodstream. Can pets contract plague and spread it to humans? Pets, particularly those that roam freely, can come into contact with infected rodents and fleas. While dogs usually recover from plague and develop immunity, cats are more susceptible and can develop pneumonic plague. However, such occurrences are extremely rare due to the low incidence of plague in the U.S. What are the symptoms and treatment options? Symptoms of bubonic plague include fever, headache, chills, fatigue, and swollen lymph nodes known as buboes. Antibiotics can effectively treat plague if administered promptly. Left untreated, bubonic plague can be fatal in 30 to 60% of cases, while pneumonic plague is almost always fatal without treatment. Where is plague commonly found in the U.S. and globally? Plague has been present in rodent populations in the western U.S. for over a century. It was first reported in California in 1908 and later spread to other western states. Madagascar has the highest number of human plague cases globally, accounting for approximately 75% of the worldwide total. How has plague persisted over the years? Despite extensive research, scientists are still unsure which specific rodent species maintain plague in the U.S. Researchers at Northern Arizona University have been collecting plague-infected fleas from prairie dogs for over 25 years to better understand plague dynamics. This ongoing work helps monitor plague activity and inform public health strategies. What factors have reduced the threat of plague? Historically, plague has caused 3 major pandemics, resulting in an estimated 250 million deaths. Today, improved hygiene and the availability of antibiotics have significantly reduced the risk of large-scale plague outbreaks. 2. tragic pneumonic plague death in Arizona. What you need to know. In a shocking turn of events, a resident of Coconino County, Arizona, has succumbed to pneumonic plague, marking the first such fatality in the area since 2007. This alarming news comes amidst ongoing investigations into a mysterious die-off of prairie dogs nearby, although health officials assert that the two incidents are not connected. On July 11th, health authorities confirmed the death, which occurred at the Flagstaff Medical Center. The individual, whose identity and details remain undisclosed, was admitted to the emergency department and tragically passed away on the same day. Northern Arizona Healthcare, the hospital's operator, released a statement indicating that despite prompt medical intervention and efforts to revive the patient, they were unable to survive. Pneumonic plague is a serious lung infection caused by the bacterium Yersinia pestis, and it is quite rare in humans, with only about 7 cases reported each year in the United States. Unlike the bubonic plague, which historically devastated populations in medieval Europe, pneumonic plague can be transmitted through the air via respiratory droplets, making it more contagious. While both forms of plague stem from the same bacterium, bubonic plague is typically spread through flea bites from infected rodents or contact with contaminated materials, primarily affecting the lymphatic system. In contrast, pneumonic plague leads to severe pneumonia and respiratory distress. The recent death in Coconino County is particularly noteworthy, as it represents the first recorded instance of pneumonic plague mortality in the region in nearly 2 decades. However, it is not the most recent case of plague in Arizona. Since 2006, the state has documented 7 instances of the disease. The last recorded death from plague in 2007 involved an individual who had come into contact with a deceased animal that was infected. According to the Centers for Disease Control and Prevention (CDC), the United States sees approximately 7 human cases of plague each year, with only 15 deaths attributed to the disease over a span of 23 years starting in 2000. Most of these cases occur in rural areas of the western states. The CDC explains that Yersinia pestis naturally cycles among wild rodent populations, and while flea bites are the most common route of transmission, humans can also contract the disease through exposure to infected pets, particularly cats. The timing of this human death coincides with a sudden and unexplained die-off of prairie dogs northeast of Flagstaff, which may also be linked to plague. However, local officials have stated that they do not believe there is a connection between the human fatality and the prairie dog deaths. In light of these events, health authorities have issued precautionary guidelines to help prevent the spread of plague. These recommendations include avoiding contact with wild animals, steering clear of sick or deceased animals, refraining from camping near rodent burrows, and not sleeping directly on the ground. They also advise using insect repellent and tucking pant cuffs into socks to minimize exposure. Coconino County health officials have reassured the public that the risk of human-to-human transmission of pneumonic plague is extremely low. The last recorded instance of such transmission occurred in Los Angeles in 1924, according to data from the National Institutes of Health, NIH. Despite the rarity of pneumonic plague, the symptoms associated with it can be severe and include fever, chills, headaches, weakness, muscle pain, and swollen lymph nodes, known as buboes, which typically appear in the groin, armpits, or limbs. Symptoms usually manifest within 8 days following exposure. The recent death and the prairie dog die-off have raised concerns among health officials, as plague is one of several diseases endemic to the southwestern United States, alongside West Nile virus, hantavirus, and rabies. Trish Lees, the communications manager for Coconino County, mentioned that the exact number of prairie dogs that have died remains unknown. This situation prompts a critical question. How prepared are we to handle such rare but serious health threats? As we navigate these unusual circumstances, it's essential to stay informed and vigilant. What are your thoughts on the measures being taken to address this public health issue? Do you believe the risk of plague is being adequately communicated? Share your opinions in the comments below.